Okay, hi. Today we're gonna talk about the upper cervical dysfunction after the injury, like a car accident or a work injury or blow to the head. Very often, people have torn ligaments, like an alar ligament or a damaged ligament, stretched beyond its normal limits. And what it does, it makes on one side or both sides. Usually, it's on one side. The bones move too much and move improperly. Bones like first vertebra and second vertebra, which stabilize upper cervical rotation. And patient with that kind of injury will, if misdiagnosed or not treated properly, will have severe headaches for the rest of their life, can have a lot of dizziness, difficulty concentrating on task at hand, and the treatment is not that difficult, but the patient compliance is absolutely necessary for this. And this is another reason why you want to be tested after the car accident or injury to the head or neck with a doctor who had training in this kind of in this sort of rehabilitation. So let's talk first about the C1 rotation. A patient has a rotation to the right, which is of C1, which is severe. It's a 5 degrees. If a rotation is more than 4.5 degrees, that's a problem. So the exercise, the patient is sitting straight. So vertebral rotation is to the right. So what we're going to do, each muscle has origin and insertion. Origin, when the muscle originates, and insertion points is the one that muscle moves towards itself. So origin is stationary, and insertion point is moving. Muscle can only actively contract; it cannot actively stretch. So in other words, it cannot push. For muscle to stretch, another muscle has to contract and pull this muscle away from the insertion point. But the point is that if what we're doing with this exercise, we're changing insertion and origin, we're flipping them off. We're going to do, it's called progressive resistance exercises, and we're going to pull origin towards the insertion point. That will shift the vertebra and put it back in place. And when muscle is going to be trained properly, it's going to replace the function of the ligament, and it's going to function as that ligament stabilizing the upper cervical rotation. So you sit straight, put a chin straight, put the hand on your temple, elbow out like this, like so. And what you do, you hold with your hand, and you turn your head to the left as if you want to look behind you, but don't let it turn. You will feel the tension right there. That's the muscle that is working. So now what we did, we changed the origin and insertion point, and we're pulling the vertebra towards the target, and it will actually turn and rotate the vertebra and put it back in place over time. The patient has to do it for 45 seconds. Okay, so stop now. Another muscle that we need to train, it's a C2 rotation. It's one of the suboccipital muscles. And C2, for C2, we need to tilt head down. Patient puts the hand behind the head, grabs the elbow with this hand, and head is not supposed to move at all. So what you do, you pull your hand towards your head, and you start rotating at the same time and pushing back against the hand and pushing chin down. And in this position, this rotation, the patient will feel tension right here. That's the muscle that is working, rectus capitis, and hold it for 45 seconds. And patient will have to do these exercises for 15 to 18 months to stabilize his joint.